welcome for this month's blogcast, Dana Turner, who's in Chicago. And you're the first of our international patients to join me in this conversation. And you're a young patient, and I understand you connected with us through the Young Patients Network, which is an exciting new venture that has really taken off this year. Dana, can you tell me about how you were diagnosed with your MPN, what it is, and how it's impacted on your life?
Yes. So I was diagnosed when I was 29 years old, and I am now 34. I actually had high blood counts since I was 4 or 5 years old, but my pediatrician had never really flagged my high platelet count when I was younger. So when I saw an adult physician after I turned 18, she had issued a full blood count and things didn't seem flagged for her, but she did not issue another one until I was 29. And at that point, my full blood count results indicated that my platelets were in the 800s. And so she had me retested. And at that point, they were in the 900s. So she had referred me to a hematologist in the Chicago suburbs. And the hematologist did more testing. She specifically did blood work for JAK2 and other mutations. Interestingly enough, my blood work came back negative for all mutations. And so she told me if my blood work came back negative, she would ask me to undergo a bone marrow biopsy to check on the molecular level to see if I had those mutations. So I had a bone marrow biopsy in September of, I believe it was 2019. And that actually did come back positive for the JAK2 mutation. And so at that point, my diagnosis had changed from ET to PV molecularly. So that is when I was diagnosed. It's interesting because I feel like I've lived with an MPN for such a long time, since when I look back at my pediatric records, my platelets have been elevated in the 500s since 1994 or 1995 or so, when I was 4 or 5 years old. And I remember when I was younger, I would start getting migraines with aura. I just thought it was something all kids would experience, where you'd have that kind of flickering type of light affect my vision from time to time, as well as Raynaud's disease symptoms, where my fingers and toes would get white and numb in the winter or whenever it was cold. But I kind of let those symptoms slide for a bit, just because I thought everybody did experience them. Also, I did experience, and I do still experience, some fatigue related to my MPN. Right now, thankfully, my fatigue is not as severe as it once was. It was probably the most severe when I was undergoing venesections or therapeutic phlebotomies, as we call them here in the States, because my iron was a lot lower due to those procedures.
And how is it impacting you now? Because you've recently got married and starting a lovely new life. And what's your symptom burden like now?
Yeah, that's a wonderful question. Thankfully, right now, my symptom burden is thankfully quite low. I've been on Besremi since February of 2022. And since starting Besremi, I have not needed a venesection or therapeutic phlebotomy, which has greatly improved my iron levels, which have also reduced my fatigue. I still get migraines with aura from time to time, maybe once every 2 to 3 months or so, more often if I'm feeling more stressed out. And I still do have symptoms of Raynaud's, and those symptoms are actually probably the most impactful. And those are usually caused by like my capillaries getting more constricted, and it is more of a vascular type of event, just like the migraines with aura. So I'm very thankful that my day-to-day symptoms of PV are quite minimal, except for periodic Raynaud's flare-ups or those migraines.
And how's it been for you in the workplace? Have people been sympathetic? Do you find it's people have an understanding of MPNs, because they're so rare, but maybe in Chicago they're less rare than they are here?
I think it's still quite rare, regardless, because even my hematologist has not treated a patient who's my age. And I think I'm one of her only patients who are currently on Besremi as well, even though Besremi is accessible and approved for polycythemia vera. So, it is still very rare, and nobody really knows about PV or other MPNs unless I tell them more about it. And I thankfully have a very supportive workplace. I did tell my my boss more about my PV diagnosis when I started working here 4 years ago, and she's been extremely supportive of me. I have not really needed any accommodations. And at my workplace, I am a licensed clinical social worker. So I am working very independently, working with teens and children and families who are struggling with their mental health. So I feel like because of my own chronic illness experience, I do have a lot of empathy for my clients and am able to better relate to them, especially when they're struggling with something more related to their physical health.
That sounds wonderful. And talk to me about the Young Patients Network, because it is new and it's lovely to see you, as I say, from Chicago, and your experience of MPN Voice's initiative that's is largely Alice, the wonderful
Yes.
Alice.
Alice is amazing. And so I'm very thankful for her advocacy within the MPN community. And I'm also very thankful that I had found MPN Voice, although I wish I was in the UK in order to experience some of the in-person events and to network with the rest of the patients located overseas. But I found it very enlightening and just so supportive to have other voices who resonate with mine. Because when we traditionally look at an MPN patient, we think about an older population of patients who might be struggling, who might be diagnosed in their 50s or 60s or even older, with more traditional treatment approaches. But I feel like it's extremely important to advocate for early detection and, importantly, to prevent disease progression with younger patient profiles.
I think that's very valid. And you know, when I look back in the 33 years that I've had an MPN, it's amazing how the science is progressing. You know, every year there's something new, and I feel that the future certainly looks incredibly bright, certainly in this country. I mean, there are several new drugs coming down through the line for MF, but it's different in every country. So, I mean, what's it like for patients in the US? Is it easy to get the right drugs for MPNs, or do you have to make a case for them?
Yeah, I think it depends on your private insurance because there are so many policies in the United States regarding medical coverage where there are, a lot of private networks and then there are some public networks for those who might be low income or those who might be considered as disabled. I do have private insurance and it's not through my employer since I am an independent contractor with my work. So I had to purchase my own health insurance through a public marketplace, which tends to be more expensive and oftentimes more limited in the drug coverage that they offer. And I also found that I had to advocate for myself. Since my original treatment was like aspirin therapy, as well as therapeutic phlebotomies or venesections, I was put on this watch and wait protocol of let's not give you medication until you're over 60, or if you have a blood clot or some other cardiac event, let's just do the bare minimum. And being young, I did not feel comfortable with the watch and wait approach. I felt like I was a ticking time bomb. Like I don't want to wait until I have a heart attack or a blood clot in order to start medication. So I did a lot of research, namely just through a lot of like peer-reviewed journals, a lot of scientific articles. I was following a lot of MPN blogs and websites to find out about current treatments and those that would be recently approved. And I thankfully came across Besremi. So I brought that information back to my hematologist around, I would say, December of 2021, right as it was getting approved in the US. And I said, look, I'm young. This is approved for low risk patients, and I am a low risk patient. I said, I want to try this. And, she said, let's get this started. So typically what that looks like is doctors would have to send like a pre-authorization request to your insurance, and then the insurance would come back and either approve or deny the request. But because Besremi is approved for a first-line treatment in the United States for low-risk patients without a history of medication, I did not have any issues getting Besremi approved. And then the manufacturer of Besremi also had provided me with a grant, in which I still have, in order to provide it to me at no cost, which I am extremely grateful for.
Gosh, that's quite a journey though, isn't it, to achieve that? And of course, being young, I guess the question of pregnancy must come into your mind from time to time. Have you got any information about that? Have you been able to talk to the physicians about that?
I have, and I don't have a desire to have biological children just because of not just having PV, but I also have a sister with a congenital disability. And so that disability might be inherited. And there are just some other factors that make pregnancy more high risk for somebody like myself. So I've told my doctor I'm not interested, but she did tell me that if I were to get pregnant or if somebody on Besremi were to get pregnant, to let their doctor know right away, because there might be some counterindications with medication and pregnancy.
So the message is talk to your doctor.
Absolutely.
Yeah.
And
This is
typically patients, yes,
yeah.
I'm sorry. And typically patients with PV are more high risk for pregnancy, just with like early fetal loss, more risk for blood clots. My doctor did tell me I would have to be on, blood thinners throughout pregnancy if I were to choose to get pregnant. So there are some medical considerations that, of course, shouldn't be ignored.
Okay. And tell me, what would you wish for the future for MPNs? You're young and you've got life ahead of you. How would you like to see MPNs and treatment for MPNs evolve?
I would love for a cure. Of course, I think we'd all love that, obviously. But if not a cure, I think just more accessible medication choices for patients. Instead of, saying, look, we have to do watch and wait, and then we try something like, HU, and then we try something like an interferon. I think we should allow patients more choice to choose the medication that is the most appropriate for them and their current needs. And so that being said, I think I'm definitely hopeful for more research and more clinical trials for patients to start trying different medications and seeing what might not just reduce their symptom burden, but reduce their genetic mutation if they have a genetic mutation and enhance quality of life.
Dana, this has been just amazing, and I can't thank you enough for taking the time to talk to us. And I hope, like you, one day you might come over to one of our this coming weekend, actually, we've got an International Patient Day, and it is online. Are you going to watch it online?
I wish I could, but I'll be on vacation this weekend as well, so I won't be able to, but hopefully I'll watch the recording if somebody is able to record it.
Oh no, it'll go up
Oh,
on the YouTube channel.
amazing.
But
I will
thank you
watch.
so much. And it's been a real pleasure to meet you and to hear your story. And I'm sure it will be immensely helpful to other young people diagnosed with an MPN. Thank you.
Great. Thank you so much, Nona, for having me. I appreciate it.